I think on Social Security, ultimately, not for the people who are waiting right now, but down the road, maybe people under age 40, whatever, you have to begin to maybe raise the retirement age or jiggle a little bit with the benefits. On Medicare, the problem you have with Medicare is the problem you have with our whole medical system. There are no incentives for the individual to watch their own costs. And this is a problem we have in the private sector. One of the things we are going to do in the state of Wisconsin, we should duplicate on a federal level, is begin to take the employees and begin to offer them a market-based reform. Okay, in my district, a guy by the name of John Torinas has written a book, does a very good job in his own company. This is beginning to be done in places like the West Bend School District, where you begin to have market-based health insurance, which results in a huge savings. But among other things, what it does is it changes the culture within the medical community itself. There are certain areas, Steve, in which medical costs have fallen. Areas like LASIK surgery, areas like cosmetic surgery. Costs have fallen. Why? Because it's pure free market. We have to get more free market involved in other medical procedures. Right now it's not, because you don't have a large enough segment of the population in market-based plans. You can get more of that culture just through the huge sea of federal employees, and then you've got to begin to put that culture in the Medicare, Medicaid world as well.
I mean, I have doubts, and I'm at 45. I've been working hard since a 12-year-old, and paying money into Social Security. I doubt whether I'm going to get that. But that's a commitment that we made to the citizens of this nation. We need to fix that system, and again, that might mean there have to be some changes. I would rather have my government be honest with me and say, "Hey, Joe, this system has to be changed so that you have some benefit for the hard work that you've done throughout your life." And I think most Americans would respect that. Again, right now, we just push this can down the road, and we're not dealing with any of the challenges. We're not providing any answers, and that's just making the system and the situation even worse.
Right now, when you look at the entitlement programs, as much as we all want to do everything for everybody, government's too big. We just cannot afford it. And I think the last thing we want to do is provide entitlement programs that ultimately we have to dial back in a way that wouldn't be good in terms of the feasibility that they have in our country's budget. So what I think we need to do is we need to take some steps there. If you look at what the entitlements, how they're growing, I mean, they're going to be a huge portion of our total government expenditures in not that far from now, and it's going to inhibit our ability to deliver other services as well as our national defense.
If they're not going to have as much money that they're putting in, maybe we can give the workers that are on Social Security an option to be able, just like a 401k that you have at work. Not that you're using it as a 401k, but in Social Security, I can opt to put a little more in. When you're in companies, when I worked for Chrysler, I had 401ks, and each time I could get a raise, I'd put a little more in my 401k. Okay. So if I put that more in, that's going to help me out with my retirement. Same thing is with Social Security system. The younger people, if they want to rely, you still have IRAs they can rely on, but if they feel they need that Social Security income, add a little more to it.